Hello and welcome to 72 Dragons Health. Today we had the pleasure of speaking with Dr. Marlo Vernon. Dr. Marlo Vernon is an experienced research scientist with expertise in data analysis, public health research, maternal and child health, grant writing, and program assessment. She is an associate professor at Augusta University's Medical College of Georgia, Georgia Prevention Institute in the Department of Obstetric and Gynecology. Dr. Marlo Vernon is the co-chair of the Program Planning Committee for the American Public Health Association's Cancer Forum. Welcome to this interview, Dr. Marlo Vernon. We are honored to have you with us today.
Thank you so much for the invitation.
Dr. Marlo Vernon, can you tell us about some of the exciting public health initiatives and projects the Cancer Forum at the American Public Health Association is discussing or implementing?
That would be my pleasure. So one of the main things the Cancer Forum does is we host abstract presentations at the American Public Health Association annual meeting. Last year, we had 158 abstracts submitted, and we were able to accept 44. We present a variety of opportunities for people to present their work as it relates to cancer. One way is roundtable discussions, which is my particular favorite. People get to present their work to a small group of people in a short period of time, and then they move tables around. And it really gives people an opportunity to have a personal presentation and experience with the presenters. We also do the traditional oral and posters. And some of the other things that the Cancer Forum does is we host a lot of webinars. In the last year, we've hosted 4 webinars, and we like to do those in collaboration with other APHA sections and forums. We've done one with the epidemiology section and with the public health and education and promotion section as well. And those really allow us to highlight important aspects about cancer research, including one on Medicaid expansion and breast cancer endocrine therapy and how the two intersect. And then we also have an arm of our work that focuses on policy. So we participate in letters, for example, to the CDC, to the Congress, to support funding for cancer research, not just for treatment, but also the important public health component of prevention.
I think you already mentioned some of the item for the next question, but please tell us about any project collaborations with other caucuses, forums, nonprofit organizations, or academic institutions during your tenure as program planner in the Cancer Forum at APHA.
Yes, so one really exciting thing we're doing this year is we are co-hosting a session with the Latino caucus. And so we have set up a poster session in collaboration with them that highlights cancer screening, navigation to screening, treatment, and prevention efforts specifically among Latino and Latina populations. So we're really excited because that's a new connection for us this year.
That's wonderful. Now, how has your experience been as an associate professor at the Department of Obstetric and Gynecology at Augusta University's Medical College of Georgia? And what are some of the academic projects you are working on?
It's been a wonderful experience. I have lived in Augusta for a long time now, over 20 years, and it has become my home. Within the Department of Obstetrics and Gynecology, I'm really at an interesting connection because I sit on the university side of our institutions, and we partner very closely with what is now WellStar MCG, which is a hospital system. And we just recently turned over our academic hospital to WellStar and merged with them. And so we're still, learning how to work together. But the research that I do is very public health focused, and I have partners with the clinicians now. One of the most in-depth projects I'm working on right now is actually funded by the Georgia Department of Public Health and through the state legislature. And we're looking at how to support women during and after pregnancy. Georgia is one of those states that chose not to expand Medicaid. But with the 2022 legislative session, they did extend Medicaid for 12 months, which is incredibly important because this allows moms to have medical care in that very important first year postpartum. Georgia, unfortunately, has high rates of maternal mortality and morbidity. And by extending Medicaid for this year, we are able to navigate moms to primary care, which they might not have. If they experienced any complications during pregnancy, including hypertension or diabetes, we're able to make sure that they're followed up by a cardiologist. This is very important. We live in the stroke belt. We live in the cardiovascular disease belt, for example. A lot of, unfortunately, negative health consequences associated with obesity, for example, are all present where we live. And this unfortunately affects the health of mothers in between their pregnancies and during their pregnancies. So what we heard really was that everyone was very excited about this extension, but when it came to putting it into practice, mothers and providers weren't really sure how to implement it. And so we have a component of our project where we do teach moms how to self-monitor their blood pressure, and we ask them to watch their mental health during and after pregnancy, because cardiovascular concerns are one of the leading causes of death for moms in our state. So they understand and are able to have constructive conversations with their providers during and after pregnancy. And then after pregnancy, we make sure that they're doing everything they can. We support them, we educate them with nutrition support, with breastfeeding support, with navigation to social and environmental resources that's needed. And then also making sure they get connected to those specialist appointments if they need them. You know, eye exams are covered. Dental care is covered. Lots of things that you just don't necessarily think about, which all contribute to overall health. That's our main project. We also do work with our public housing community, educating them about cancer, specifically colorectal cancer, breast cancer, and prostate cancer. And we have a navigation system set up alongside this education. So when they recognize that they're eligible for a certain screening, we help them get that screening. That project is about to end, and that one was funded by the American Cancer Society and Pfizer. But we're really pleased with the results. One thing that I was most impressed with was we gave these participants information about healthy eating and physical activity. And in the post surveys, they indicated that they improved in their knowledge and they actually made health behavior changes, which was really exciting to see. Because if we can intervene on those modifiable risk factors, we're going to reduce people's cancer risks as well. So that's just a snapshot of what we do here.
Very impressive and valuable work. Now, what are some significant changes, in particular, and upcoming challenges regarding maternal and child health in the public health domain?
What I see as one of the main challenges is that women are entering pregnancy at less than optimal health. You know, women these days tend to delay pregnancy, so a lot of first-time moms are older. With our obesity problems in our country, you know, obesity is related to multiple comorbidities, whether it's related to cardiovascular health, increased risk of gestational diabetes or diabetes overall. When a woman is pregnant, her blood volume increases by 50%. That puts a lot of strain on a body that's perhaps not optimally healthy. One component of this is access to fruits and vegetables, to grocery stores, to walkable communities. When I do research and look at problems with my communities, I look very closely at that socio-ecologic environment and how all those components are intersecting to impact the health of moms in our communities. Entering pregnancy at a healthy state, I think, really influences maternal health. And another component that I found is that a lot of women are not well educated on what it means to be healthy and what it takes to be healthy. That means going and getting your primary care wellness checks. And so we make sure that everyone else is getting their well checks, but we don't always remember to get ours. And that's another important component. And then making sure that there's adequate access to care. Some women in our state have a really hard time finding obstetrical care, and many rural hospitals no longer provide delivery services. And that means moms are skipping prenatal appointments because it takes a long time to get there. Sometimes you have to wait. They don't feel or see the value of it. And so we're missing things that could be treated earlier in pregnancy. And so access to care and then entering pregnancy in a healthy state are two big components that I see as important to improving maternal health in our country.
Are there any public health policies or initiatives you are looking forward to regarding cancer as well as maternal and child health from the American Public Health Association annual meeting in Minneapolis, Minnesota on October 27, 2024?
I'm really looking forward to seeing what everyone's advances are, particularly in reaching our underserved communities. We know that if you're not getting adequate preventive care, you're at higher risk of cancer or, having issues as it relates to maternal and child health. One other component that I'm looking forward to seeing is what efforts are being made as far as family-based interventions and outreaches are working. I'm a huge believer that the family home, if it's a healthy home, provides a healthy family. And those habits that are passed from parents down to their children make a really big impact on current and future family life. And so those are some really exciting opportunities that I'm looking forward to seeing at the conference.
Thank you, Dr. Marlo Vernon, for joining us today. It was a pleasure to learn about your experiences and expertise in the public health domain. We hope you have a great time at the upcoming APHA annual meeting. Thank you.